A simple fact once regularly observed, publicly mourned, and culturally accepted. Recent generations, however, have distanced themselves from death. As emphasis on and success with physical treatments has grown, the psychological, spiritual, and familial needs of dying patients have often been overlooked. But no one escapes death forever. Decades of research have emphasized team care as the most effective way to treat critically ill patients and their families. Hospice teams may take the most comprehensive approach, but patients in all settings can benefit from some aspects of team treatment.
Mary's doing okay, basically, but she told me she hasn't been in any pain, and the massaging that you recommended, Peter, has been helping. But she is definitely weakening. She was quite breathless just walking across the room on Monday. Her spirits seemed to be pretty low.
She was depressed when I was there yesterday.
And what does her daughter say?
Her kids were acting up when I was there, so I didn't get a chance to talk to her without constant interruptions. She did mention Mary was becoming more passive about her medications, leaving it up to Kay whether she took them or not.
Yeah, I got that feeling, too.
Whether in a hospice, home care, or hospital situation, in a team approach, professionals gather regularly to address their patients' evolving needs.
There's the physical realm, the emotional, the social, the spiritual realm. All of them are given equal importance in the way that we approach care, and the team allows us to meet all of the varying needs.
The team includes, the nurse, the doctor, pharmacist, social worker. With hospice, we have a spiritual chaplain, director, what do you want to call her? We have a bereavement person. We can get physical therapists, occupational therapists.
Depending on the environment, a variety of disciplines, including nursing aides and volunteers, can augment the team.
So the feeling is that the family is handling things fairly well.
Yeah.
Well, I'm going to prescribe Lasix for the edema. It may work a little better for her considering her underlying CHF.
It's teamwork. The doctor is equal to the nurse, is equal to the therapist, is equal to the medical supply people who bring out the hospital bed. We're all a team, but we all have a job on that team. And being the doctor, we're sort of like the quarterback. I sort of lead them to make sure that we cover all 4 points on each patient. How's the physical, how's the psychological, how's the spiritual, how's the family, and keep everybody focused on what are our goals.
When are you going out to Mary's again, Father Will?
Assessing the full spectrum a patient needs begins with trained observation.
How about your breathing? Is the procardia helping you?
It's the same. Maybe a little worse at night. They're all the same, really.
What's all the same?
Medications, the pills. It's all the same in the end.
It may be all the same in the end, Mary, but how about now, today?
The nurse is one member of the entire team, and no member is more important than any other member. The nurse that is in managing the case perhaps sees the whole picture and makes sure that the other resources are being used.
In acute care environment, the greatest challenge for the nurse is they have so many patients with so many treatments and procedures that need to be taken care of. And in the case of a dying patient, what is needed for the most part, are comfort measures and time.
Nurses need to be an advocate. I think the medical community as a whole is starting to come around to the idea that death is okay. But still, I think nurses have to continue to pave the road a little bit.
People who work closely with the dying need to have a deeper understanding of their emotional concerns.
She's like this all the time now.
Well, it's true.
What's true?
It's not working. I'm dying.